convoluted, but it follows along with what the doctor was just talking about. Several of you have used the term free health care, and there is really no free health care. Everybody pays. Somebody pays. The Medicare issue, people have paid into it for years, and it's not going to be available. The cost or the prices keep going up for the users. The shell game that Dr. Ciola talked about earlier, I think that the problem appears to me to be a lot more than just health care. It's an attitude of entitlement throughout the country where everything is taken care of, and as long as you don't have to see the bill and you don't have to account for it, the government's going to pay for it. I think people don't realize that money that the government is using to provide that, quote, free health care is coming from tax dollars. So it's costing us more and more, and it's along the lines of welfare programs and other Social Security, where it's not going to be there when we need it. It was talked about health savings plans. If there is health care reform, what kind of measures need to be put in place where 20 years down the road, those health saving plans aren't simply just another form of Social Security if they're mandated?
Dr. Thompson?
Yes, because...
Dr. Bessler?
You want to answer?
Sure.
Okay.
Do I want to?
Yep.
No, I think you're absolutely right on the entitlement, and that's where, just from my own personal belief, and I think several on the panel, that's why you want the choice to be yours. You want to have the choice to make the decisions of how you act and behave, and the repercussions of doing those things. So there has been a shift, and when you talk about the entitlement programs that have been put in place, there's a huge political backing behind those very programs that make it hard for them to ever change. And I'll make one comment along those lines. President Obama in his speech made a comment about that any legislation that came across his desk that added any bit to the federal deficit or the federal budget was going to be vetoed. Okay, that's fine. Yes. But what was the very next statement out of his mouth? If it did, I would then put in legislation or some sort of statement that requires spending cuts to be taken out to pay for that difference. Now, wait a minute. You either are or you're not. So in other words, the translation is I'm going to pass the buck to a future president to have to make that decision, to have to make that tough decision where some spending has to be cut out to make up for this loss estimate. And you can certainly see on the Medicare and what Johnson's estimates were, they aren't the very best at forecasting out future costs and anticipation. So I guess that's where I would end with.
What we need to do, and pardon me for my age, but we need to rush back to the future. We have a cultural shift since World War II. I was in practice before Medicare and before third-party payers came into the system in any degree at all. We had health care insurance. I remember one patient came in and wanted to know what she needed a cataract extraction and said, well, I have insurance, White Cross it was called. What does it allow? $5 for a cataract extraction. People sometimes don't understand what they're getting into. And the health issue is a nice one to confuse people if you're a charismatic con man. Talk fast. We got a deadline. We have to have it by August. Why? Well, you got to buy this car or it'll be off the lot tomorrow. You know darn well you're dealing with a con man.
Let me add a couple of quick things to your good observation on HSAs. We do a lot of that with employer groups, and I sit down with employees all day, every day, and talk about the importance of personal responsibility and health savings accounts. And here's why I like them so much. It's your money. It goes in your savings account, and it's your money. You get to keep it, your rolls forward, you get the tax breaks on it, you ask the questions, and you're a far better consumer than you were before. Now, if we step into reevaluating instead of Medicaid and doing the HSAs, which is a really intriguing idea, and funding some of that, a health savings account can be funded by employer, employee, or a combination, right? So government can come in and say, okay, instead of Medicaid, we might partially fund some of that HSA. And I would submit to you, put some teeth in it. That's not going to happen, but put some teeth in it and say, we'll partially fund it for a year or two. Because once enough money is built up into that account that it is satisfying a deductible, then you don't need to continue to fund it, right? So
Right.
from a government, okay, I'm looking at my tax dollars, which is what you were referring to, then perhaps we can eliminate this entitlement mentality with continued expectation by upfront saying, we're going to do this, but we're going to do it for a limited period of time. A lot of our employers will do that. Okay, I'm going to do this for the first year. After that, you're on your own. And I would submit to you that over a course of time, referring to his C curve and how things will shift, it took us a generation to get into this mess. It's going to take us a generation to get out.
That's right. That's right.
We are experiencing a tremendous amount of not only tax dollars going into this, but I submit to you that a large chunk of your insurance premium dollar is due to this cost shifting. The providers almost have no choice. Because when the Medicare reimbursements are down here, if your straight line across here is the amount of money that a provider, hospital, doctor, doesn't matter, has to break even, and Medicare reimbursements are down here, guess what's going to happen to the private sector? They do it all day, every day. So those of us in the private employer market help subsidize not only with taxes, but with premium dollar, this Medicare subsidy. So the pitch, if you will, I'm trying to be really nice here. The argument, if you will, that we can put everybody in Medicare and make it work, or expand Medicaid and make it work, is just la-la land. It is not feasible, and it will cripple business in this country.
It's part of the entitlement shift in our culture. Since World War II, we've moved into an entitlement culture, and we expect freebies right and left. And that isn't the way it used to be. When I went to medical school, we were taught that it was our obligation for the privilege of being in the medical profession. Society had given us that privilege, that we took care of the indigent, not the government, but we as individual health care providers.
In the community.
We've gotten away from that now, in that who's paying for this? Who's the third-party payer? Do you have Medicaid and Medicare? Goodness gracious, we're a gimme culture. We've got to get back to standing on our feet and pay our own way, and this is the big advantage of medical savings account, also known as health savings account. Health savings account was a term that the last President Bush used